Hello everyone, welcome back. Today we'll be talking about the difference between inpatient and outpatient coding. The difference between the two is significant and can impact the entire revenue cycle management process. In order to understand the distinction between the inpatient and outpatient coding, it is important to first define these terms. Inpatient refers to a patient who has been formally admitted to the hospital on a physician's order, while outpatient refers to a patient who is treated but not admitted to the hospital for an extended stay. To illustrate the difference, let's take the example of an elderly father experiencing a chest pain. If you call 911 and bring him to hospital in the initial hours, the hospital will run a test to determine whether he should be admitted as an inpatient or kept under observation as an outpatient. This decision is not always easy as the symptoms can be similar. However, the hospital has 24 hours to make a judgment call on whether the symptoms require hospital care or whether the patient might be better off being treated elsewhere. If you are on Medicare insurance, this decision can have significant impact on your medical bills down the road. Inpatient service tend to be more costly than outpatient service. The reason behind it: length of stay, intensity of care, use of resources, complexity of cases, reimbursement model. As an example, for inpatient care, Medicare commonly use the DRG system, which reimburses the hospital a fixed amount based on the patient diagnosis and treatment. Whether in outpatient, the reimbursement is typically fee for service based on the ambulatory payment classification, which may not cover all the costs. Additionally, if your elderly parent later requires admission to the nursing home, Medicare won't pay for it unless they were officially admitted to the hospital. This is a loophole that can end up the costing patient thousands of dollars out of pocket. To avoid any confusion, make sure to ask the hospital to explain your admission status and how that might affect your medical bills before assigning codes. This will have big impact on the revenue cycle management. That's all for now. See you in the next video where we will be discussing more information about the inpatient setting and inpatient case studies. Thank you so much for watching the video.